Okay, I know we have a full hour today, so we'll get started and people can join us as they arrive. I'll get us started with saying hello. I'm Dr. Jennifer Bombush from the UBC School of Nursing. I'd like to welcome everyone to our webinar, which is hosted by the UBC Research Excellence Cluster, Reimagining Supports for Children with Medical Complexity. You're invited to sign up for regular updates from the cluster by using the link that will be put in the chat, and a reminder that the webinar is being recorded. I'd like to begin with a land acknowledgement. The UBC Vancouver Point Grey campus is located on the traditional ancestral unceded territories of the Musqueam peoples, with work sites located across the shared territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. The UBC Okanagan campus is situated on the traditional ancestral unceded territory of the Syilx Nation. If you're joining from other territories, please acknowledge the traditional owners and caretakers of those lands. Do this as appropriate to your specific location. You can learn more about the Indigenous land that you are on by visiting this online resource, native-land.ca, and that link will be put into the chat. Today's webinar is called Building Connections, Caregivers of Children with Medical Complexity, Facilitating Communication Training with Pediatric Residents. Led by our cluster member, Dr. Esther Lee, the panelists will introduce themselves in a few moments. Throughout the presentation, you are welcome to put questions into the Q&A, and our cluster member, Dr. Lisa Olson, will facilitate the discussion at the end of the panel. We will have time for questions and discussion at the end of the presentation. So at this point, I will hand it off to Dr. Lee to get us underway. Thank you.
Thank you, Dr. Bombush. All right. Thank you, everyone, for joining us so we can share with you what we have accomplished. Next slide, please. We are very thankful for the grants and support that we received by these groups. You can see there were many that we needed. Next slide, please. So to start off with introductions, we want to start off with our lovely family partners. Starting from the top left and then going clockwise. So Annie, Hoda, Cynthia, Karen, Catherine, Anne and Riley, and then in the center, Linda and Jesse. Cynthia is the Sunny Hill Patient and Family Engagement Lead who helped lead this project from the family partner lens. Our family partner team members are people with lived experience who are in different parts of their medical journey and from different parts of BC. Next slide, please. For the rest of the team members, Judy is a pediatric resident and our project lead. Lisa and Jenna are medical students at UBC who are project assistants. Mimi is our research coordinator and our artist. And I'm a pediatrician with expertise in complex care and palliative medicine and acted as the project supervisor. So our agenda today is to share with you how we developed our workshop, share with you our results, as well as our future directions, including our language guide. Excellent. The main objective of this project was to create a workshop for pediatric residents that was co-led, co-designed, and co-delivered by family partners, as well as a pediatric resident. This allowed for people with lived experience to guide what the pediatric resident should learn, as well as to have the service users, the pediatric residents, to guide their learning as well. Unlike other studies where family partners or students are asked to give feedback occasionally through a project, we made sure that they were involved from the start and also involved in the design as well as delivery. Over to Judy to share about the workshop development.
Hi, everyone. So I wanted to start off by explaining the motivation behind this project. As many of you already know, children with medical complexity are defined as those with significant chronic health problems and high healthcare needs who often require medical technology to improve or sustain life and daily function. Although they make up less than 1% of the pediatric population in Canada, they account for around a third of pediatric hospitalizations. Pediatric residents like myself have completed medical school and were doctors training to become pediatricians. In Canada, pediatric residents are primarily trained out of a tertiary pediatric care center such as BC Children's Hospital. Despite around a third of the patients we see being CMC, pediatric residents have previously expressed in a survey study that they only feel somewhat confident or less in all areas of complex care, regardless of their year of training. Beyond the obvious, this is an issue as physician lack of confidence has previously been identified as a driver of disability-based discrimination in healthcare. In addition, caregivers of CMC have previously identified interactions with healthcare providers to contribute to medical trauma, and compared to caregivers of children without medical complexity, overall they report less trust in the healthcare system. So our solution to this problem was to co-create a communication skills workshop for first and second year pediatric residents with CMC and their families. The goal was to increase pediatric residents' self-entrustment scores, which is just a really fancy way of saying that it's their reported self-confidence in communicating with CMC and their families. In terms of our timeline, we got started in November/December of last year, and we began by recruiting our family partners from a network of existing family partners who have previously been involved in other medical education projects. Although we say that this project is about CMC, I want to clarify that we did not recruit solely from the complex care program at BC Children's or from any other specific clinic. We were very grateful to have Cynthia from the start, both as someone with experience in patient-family engagement and as someone with lived experience. She really helped us navigate how to meaningfully engage with our family partners. Grant applications were tricky because we really hoped to secure some funding prior to recruiting family partners so we could confidently say that we would be able to appropriately compensate everyone. But at the same time, I was saying in my grant applications that we didn't yet have a clear idea for the curriculum because it had to be developed with our family partners. In addition, grant applications often take months to hear back from. We were very transparent about all of this with our family partners from the start. Thankfully, we were able to secure several grants in the end, but we didn't know this at the time of recruitment. Despite this, we had a lot of interest in the project, and we were able to recruit 8 wonderful family partners who brought a wealth of experience. The group was comprised of 1 adult who had graduated from pediatric care and 7 caregivers of CMC. In terms of workshop development, this occurred over 11 virtual meetings over the span of about 6 months, as well as email correspondence in between the meetings. We really wanted this workshop to have been co-developed with our family partners, meaning we wanted them to determine the objectives, the key takeaways, and the content. What we wanted to avoid was tokenism, where we told our family partners, this is the workshop, this is what we think the residents should learn, please share your stories with us. So at our very first meeting, the only thing on the agenda was discussing this question. What do you think is most important for future pediatricians to learn when it comes to caring for children with medical complexity and their families? From there, the study team kind of took a step back as our family partners shared their stories and started building off of each other. Despite having children with different medical conditions and being in different stages of their medical journey, there were a lot of overlapping themes that came up in the stories, and we were there to kind of help identify these. We recorded our meetings so that we could take notes afterwards and allow for natural discussion during the meetings. From the themes that we identified, we decided to narrow it down to 2 topics for the workshops: building partnerships and having a strengths-based approach to care. We decided along the way that we wanted to film videos of our family partners because we all know that life is unexpected, and despite our best efforts, not everyone might be able to make it on the day of the workshop. The videos were a way to ensure everyone's stories were heard. Our workshop happened in June, and it was 3.5 hours long. There were 2 separate sessions centered around the themes I mentioned, and there was also a debrief at the end for all the residents with the family partners, then a debrief for just the residents with Esther, as well as a debrief for just our family partners led by Cynthia. Currently, we're still working on evaluating the workshop, and we're excited to share some of the feedback that we were able to gather later on in this presentation. For now, I wanted to end this portion by sharing a 1-minute clip from one of our videos.
Strengths-based language isn't always about being overly positive all the time. You don't need to cover your words in marshmallows. Some things that need to be said are just difficult to say. Riley's now has caregivers coming in and they help with some really personal care issues. And for these workers, there's a difference between saying you can't do this or you're unable to do that, and rather saying to Riley, I know you're able to do that, but would you like help with this? It's a switch in the language. It's not about what he can't do. We're well aware of what he can't do. Let's focus on how you can be helpful. I remember when Riley was young, we were talking about how, you know, he was very aware about what he couldn't do, but it turned into like, wow, like, you know, you may not be able to run as fast as your friends or kick the soccer ball as far, but man, you're an amazing brother. You're really supportive of your sister and you talk so well to her. So, I mean, it was like looking for those positives amongst the known negatives. I think I find that when this doesn't happen, when everything is framed negatively for the parents, things are hard.
Next, we'll hear from our medical students, Lisa and Jenna.
Hi, my name is Lisa. I am a second-year medical student at UBC, and Jenna and I have found the opportunity to be involved in this project to be really, really special. And as some of you may know, the first 2 years of medical school are mostly lecture-based with limited patient interactions, especially with families and children with medical complexity. We feel lucky to have been able to learn from the experiences of family partners at this point in our training, which is inaccessible from any lectures or textbook. And something that really stuck with me was the honesty and vulnerability that our family partners brought when sharing their stories, hearing about the day-to-day challenges they face, navigating their fragmented care and resources, advocating for their children, and trying to make sense of medical information really helped me understand the realities and complexities of care that goes beyond the textbook. And one of my biggest takeaways was the importance of asking for individual preferences. Every child is different. Every family has their own ways they communicate, make decisions, and want care to be delivered. I also learned how important it is to communicate with honesty and clarity. One quote that really stuck with me was, "Claire is kind," and that is something I will carry into my future clinical encounters. Now I'll pass it over to Jenna.
Yeah, overall, participating in this project has been truly an invaluable experience. There's been so many different things that I've learned, so it was kind of hard to narrow it down to 3 main things. But I think for me, the first one is seek beyond the clinical lens, because often it reveals a context we cannot see from purely a clinical lens. And then the second point is to continuously stay curious in your practice. There's always more new things that we can learn from our patients, from our family partners. So it's important to always be curious and to continue to ask questions and to seek clarification. So this was another key point for me. And then the last one is that there is a tremendous amount of diversity within complex care, and medical complexity does not look the same across families. So each story that I heard offered a unique takeaway. And I am forever grateful to have been able to learn from our family partners. And a quote that really stuck with me was that you may see thousands of kids with this diagnosis, but to me as a parent, there is only one. I would like to greatly thank the family partners that have been involved in this project with us. And so now over to you, Karen.
Hi, I'm Karen. I'm one of the family partners involved in this experience. I live in White Rock with my partner and our 4 children. I'm a full-time care provider and medical manager for my youngest, Wesley. Wesley is complex, both medically and behaviorally. He was born with a rare genetic disorder called Smith-Magenis syndrome. His medical needs are considered life-threatening, and he is on the Connect Place program. Because of this, our families have spent years navigating the systems that are not always built for children whose needs are complex or unknown. I've often felt excluded or like we are too much for the typical medical engagement opportunities that pop up. When your child is medically fragile, every decision feels heavy. You really see where the system supports you and where it doesn't. Participating in this experience, however, was completely different. It stood apart from the other family partner roles I've had, and for the first time, I felt like my voice and my family's lived experience wasn't just being heard, but it was truly valued. I feel like Wesley's story and the reality of caring for a palliative child actually mattered to those shaping the care for the future. It felt like this team didn't just invite us in to a finished project, but it made space for us to co-collaborate from the beginning. Over several months, our team came together again and again, and we learned about each other, our children, our challenges, our fears, our hopes, and the realities of life with medically complex children and adults. We were honest, and sometimes we shared things that were incredibly hard to hear. It was really important to myself and the other families that our voices be heard in an authentic and real way. Through all of this, trust grew, a sense that every person at the table truly cared about making things better, not as a concept, but as a commitment. Our team leads, Esther, Judy, Cynthia, Mimi, Jenna, and Lisa, supported us every step of the way. They didn't shy away from the hard truths that came with complex medical needs. They listened to us fully, even when our words were heavy or emotional. They held space for our lived realities, messy, complex, beautiful, and difficult all at once. They took what we shared and gave it both roots and wings. Roots because our experiences grounded the work in truth, and wings because those truths allowed the project to grow into something deeply meaningful. We all put hard work in, and that work paid off. Together, we created a space where residents can meet with us as equals, mutuals, sharing one goal, to build stronger, more compassionate relationships between doctors and the children they care for. We had so much content that this could easily be a multi-part discussion, especially for someone like myself and the other families that have children that are very complex and multidisciplinaries are involved. Our kids don't fit into simple boxes. We created something honest, collaborative, and something that felt like the future of healthcare that families like mine desperately need. Reflecting on this experience, I truly believe this is how it should be. This is what patient and family-centered care looks like when it's real. It breaks down barriers and it builds understanding. It opens a new path, one that honors expertise that families carry and live with every day.
Well said. My name is Linda, and my husband, Jesse, was also on this project. My young son is Owen. We've been working in parent-partner roles for a few years. Projects can vary quite a bit for the experience of the family partner. I do contribute to curriculum building in other research and implementation projects, but typically this means learning something new and then adding my lived experience to it. In this particular project, I didn't feel like I was being put in a family partner box at all. The project we're discussing today differed by starting with an open space and a goal of co-learning from our collective lived experiences together. We spent many meetings getting to just know each other, hearing stories of why we each showed up to this project and what each of us hoped would come of it. We're allowed to bounce ideas authentically and organically, knowing that someone responsible was going to take notes and also share the other side of the experience that we were discussing. This allowed the family partners to be more free thinking and expand our thoughts together. We had space to feel for each other, and there was room to reflect on those notes that were being taken and then adjust our end goals as we all co-learned and co-developed together. There was a heavy weight of workshopping. It occurred consistently and frequently and had a lot of different adjustments along the way based off of everyone's experience, not just their lived experience, but their experience within the project. Each person on the team was reachable on a human level, full, complex, and welcomed. Our partnership invite went beyond the experience of our child. We were encouraged to include all aspects of ourselves, including our work or learned experience, both related to or separate from family engagement and research or policy. We were invited to bring our whole selves to the table and allowed to take up as much room as we needed or as little room as we could give, depending on the day, as family partners can show up having dealt with whatever their real lives were throwing at them in the moment. My personal experience on this project included working on the videos, and this brought everyone's story into my home. I learned a lot about them, and a lot more about them than they got to learn about me, because I was safeguarding their family photos, which was a true honor to be able to do. It became really evident when we showed up to meet in person for the first time, and I was heading towards people as if we were old friends, and then realizing, oh no, I was just getting to know them while doing the editing work. But of course, everyone was very welcoming. I think it's important to understand that family partners will start to care about each other as we work together on this. As my husband described, now we have even more families and children to think about. And we think about all of them all of the time. We worry and we care and we hope. That's just a reality for a project like this. At times, I felt in awe of the other family partners. My child is young and he's just starting his journey. I had to remind myself, because of this, that this can't be a social support group, even though they're sharing stories that I myself am learning from in order to help advocate and guide my son in our local context. We had to keep our work to the project, unless, of course, they invited friendship outside of the work. They each have so much experience in advocacy. At times, I even felt insecure because of their work experience in advocacy. Thoughts of unbalance can occur between anyone on a team like this. The team itself never created that atmosphere. That is something personal that came from within. Having Cynthia to rely upon was integral for keeping balance. There's mishaps, emotions, and need for clarity many times in projects like this. Her position of maintaining it all in an approachable, knowledgeable, and very professional way cannot be overstated. Even though the entire team was approachable, reachable, and inviting, that purposeful contact for whatever, whenever is very helpful. As this project was fully immersive, I would like it to continue to reflect where else it can expand the value of family partner skills, because they brought us into a full team approach already, and I know these incredible family partners can continue to add their lived and worked experience. And I would like all projects to learn of the necessary role that Cynthia held, keeping a visible respect for and true balance between all team members, while holding the objective of the work in high regard and always in focus, because sometimes that many family partners can get off focus. I'm really grateful to have taken part in this project. Thank you for having my family. And now over to Cynthia.
Good afternoon, everyone. As you can see, we were very fortunate to have such amazing family partners on board with us. As mentioned, my name is Cynthia, and I'm the Patient and Family Engagement Advisor for Sunny Hill Health Centre, located at BC Children's Hospital. Sunny Hill supports children with diverse needs through autism assessments, complex health evaluations, rehabilitation, and neuromotor programs. And to my work, I also bring the lived experience of guiding my daughter Abby through her complex medical care journey with cerebral palsy and a variety of health conditions. She received countless services and supports from both Sunny Hill and BC Children's until she transitioned to adult care some 5 years ago. Through her journey, I've experienced firsthand the importance of trauma-informed, culturally sensitive, strength-based, family-centered care. And it's with this lens that I strive to embed those values in everything we do at Sunny Hill. I truly feel so fortunate to be part of this amazing Building Connections team, all of whom believe in the importance of educating future physicians about the components that go into delivering empathetic, clear, kind communication and care. This kind of care matters not only to those whose children have a health complexity, but in essence to all of us who at one time or another will find ourselves receiving care. When we invited family partners to join the project, we knew it wouldn't be easy to hear their experiences and the traumas that they face. Most interactions with physicians and healthcare providers were positive, respectful, and supportive. But there are those experiences that are harmful and leave a lasting impact and scar your soul. There's many a time when parents must stand up, speak up, and voice their concerns, often at the cost of being labeled as uncooperative, a difficult parent, or simply that we don't know what we're talking about. Parents of children with medical complexity see the impact of ableism daily, when the doctor speaks only to the parent and fails to acknowledge the child as an individual with their own unique personality, communication styles, and needs that are just a little different. Or those who assume that our children have a poor quality of life and are a burden to our healthcare system and those who care for them. Our family partners have had these and countless other negative experiences that leave irreparable pain and trauma. However, families aren't participants in care. They are partners, advocates, and experts in their child's needs and conditions. And together we know and believe that with exposure and education, the pediatricians of tomorrow can and will do better for other families. That was our objective. Engagement advisors will tell you that the key to successful projects is based on relationships of trust and mutual respect. And to do so, it might result in your work not having that definitive structure or anticipated outcome. Rather, you invite the partners in to address what's important to them while supporting and nurturing that process. And for most, that can be an unknown and even somewhat scary process, not knowing what that outcome might be. We wanted family partners to feel safe and empowered to speak about what they wish for most. Engagement wasn't about ticking off a box or just to say that our family partners looked at a presentation and approved it. Rather, we involved them from the very start, from design to evaluation, presentation to creating a preferred language guide. And we learned that sometimes it's the little things that make a difference. For example, meetings are scheduled at times that work best for families, not necessarily the staff. So we usually met in the early evenings using virtual platforms that allowed representation from across our province. The first few meetings, as mentioned, we weren't all about it getting through an agenda. It was all about listening and providing that space, building trust, sharing frustrations, dreams, and hopes. And we received consent to record the meetings so we all could really focus in on what was being said and really listen with our heart and our mind and our soul to really listen and share rather than concentrate on note-taking. We also agreed to virtually record the videos so our families didn't have to have the pressure of presenting at the actual workshop, but instead could focus and feel comfortable partaking in interactive discussions. Lastly, families had that opportunity to review the videos and make suggestions to ensure their voices were accurately reflected in the curriculum presentation. And we also discussed how and when their family's video would be stored and used in future. By taking these kind of steps, we demonstrated that our work is rooted in valuing families, honoring their perspectives, and safeguarding their trust. Our small team quickly grew into a supportive community that, despite their different circumstances, we all found common ground. We didn't always agree, but there was a deep respect, an honoring of each person's lived experience, and a unity of purpose that resulted in ongoing friendships and a curriculum that we all were very proud of. In the workshops, families experienced how deeply residents valued their examples and best practices. The evidence confirmed that this patient-led curriculum truly strengthened residents' confidence in supporting children with medical complexity. And that validation is so powerful. It shows that families and others, it showed to families and others, that their voices created lasting and measurable change. And when our project ended, we were all genuinely sad to wrap up. And to me, that sadness was a true sign of success. It meant that we had built something real, something meaningful, and something so powerful. So if there's one message that I'd like to leave you with, it's this. When we listen to patients and families and caregivers, when we respect their experience, we invite them in as equals, healthcare can become stronger, more compassionate, and ultimately result in better healthcare outcomes. Next slide, please. So to learn more about how to successfully incorporate patients and family partners into your into your quality improvement practices or research, consider checking out the PHSA new toolkits that provide excellent information about engagement practices as well as a guideline for recognizing contribution of your partners. Most hospitals have patient experience staff who are more than happy to discuss your ideas to incorporate the patient and family voice in care. And of course, you're more than welcome to reach out to me as well. And we're going to head over to Judy now for some discussions about the findings.
Okay. So I'm excited to share some of the results and feedback we got. There were 38 first and second year pediatric residents eligible to participate in our workshop and complete our surveys. We had 26 attend on the day of the workshop, with the majority being in person. This was actually the best turnout we had for our regularly scheduled academic half days, which happen on every Tuesday afternoon. And the reason why residents showed up was because they knew we had family partners coming in person for the session. This is a photo from our actual workshop, and it's during the debrief session with all our family partners there at the front doing an open Q&A. To gather feedback and data to evaluate our workshop, we asked residents to complete surveys before and after the workshop. Out of the 38 eligible residents, 28 completed the pre-workshop survey. Of the 26 residents who attended the workshop, 23 completed the post-workshop survey. And we had 19 residents complete both surveys, which allowed us to pair their responses and compare their reported self-confidence before and after the workshop. Starting with the pre-workshop survey, when we asked residents about whether it is important for us to receive focused training in complex care, 85% responded either very or extremely important. Despite this, only 46% agreed that they were satisfied thus far with the training they had received in communicating with CMC and their families. To assess the residents' self-confidence in communicating with CMC and their families before and after the workshop, we presented the same two case scenarios in both surveys. In the case scenarios, we asked residents how confident they felt in performing the following 9 communication skills. For example, for the first communication skill there, we gave residents a scenario where they are attending a delivery, and they noticed that the newborn baby has several features suggestive of a genetic syndrome. We asked the residents, how confident do you feel in being able to communicate to the family that you suspect their baby has a genetic syndrome? This was the scale that we used for the residents to rate their self-confidence level. 1 being not at all confident, which meant I would rather watch a fellow or a supervisor do this task. 3 being somewhat confident, meaning I can do this by myself, but I want someone there in case I need help. And 5 meant extremely confident, meaning I can do this by myself and I could even teach this skill to someone else. So comparing the pediatric residents' responses before and after our workshop, there was a significant increase in self-entrustment levels or self-confidence levels in 8 out of the 9 communication skills, with a moderate or approaching moderate effect size for all communication skills. I've color-coded the different levels of confidence, and from comparing the two graphs, you can really see the decrease in the not at all and slightly confident, and the increase in the very confident votes. Going back to the different communication skills, the ones that are starred are the 8 skills that had a significant increase. The only one that didn't have a significant increase was number 5, but this was more less about the actual communication piece. And residents commented it was more about the fact that they didn't feel very comfortable communicating this information if they didn't have a lot of knowledge about the specific medical condition they were counseling families on. In terms of the feedback we got after the workshop, when we asked residents whether they felt more confident in communicating with CMC and their families, 91% agreed. When asked whether this workshop would impact how they communicate with families in the future, 92% responded that it would. And finally, 96% recommended this workshop to future residents. In an open question, we asked residents, what did you like about the workshop? And 19 out of the 23 residents who responded said something along the lines of the families or hearing the patient perspective. I wanted to share some quotes here from that response, with one person saying, I'm grateful for the vulnerability of the patients and parents that's shared. And another responding, I like that we are learning the patient and family side of story without discussing the medicine. I understand more of how social interactions, family dynamics, and previous trauma play into medical decisions. So now on to future directions with Esther.
Next slide, please. So I hope you all saw how we benefited from partnership in leading, designing, and delivering the workshop with family partners and pediatric residents. We really enjoyed learning from each other and felt that we were able to narrow our workshop topics with fulsome discussions. For 2027, which is the next workshop, we hope to refine in terms of the delivery, as well as increase the perspective and representation. For our next steps, we will complete the narrative analysis of the rich discussions, as well as further knowledge disseminations by other talks and publications. We also hope to make this workshop possible for other specialties and health professionals. Next slide, please. We also wanted to highlight this course. If you want to learn more about how to partner with patients and families in research or quality improvement, consider taking this course, Family Engagement and Research. Many of us, including Linda, are course grads. Next slide. This is an inclusive language guide that we were able to create from our rich discussions. We didn't mean to create it, but it just kind of organically happened, which is wonderful. You can access this and also provide feedback to us as we hope to continue to improve this guide. Next slide. This is our last slide. So to reach us, here are Judy and Cynthia's emails. And here's our photo from our end of our workshop. And we thank you for listening. And yeah, I'll pass it back to Jennifer.
Thanks so much, everyone. It actually goes to Lisa now to facilitate the discussion.
Thank you so much, all of you, Esther and the whole team, for your wonderful presentation and sharing all the work that you did. I'm just, if anybody in the audience would like to share any questions for the team, then we can kind of direct them to the person who might like to answer. And we have the Q&A tab open right now, so please feel free to post any questions that you might have in there. Right now, we don't have any burning questions in the chat, so if there's anyone else from our team that would like to share a question, I have a couple here, so
I have questions too. Lisa, do you want to go first?
Sure, I can go first. I had a question about thinking about the workshop is a wonderful way to share your learning and communicate some of the important findings with residents. I wondered if there was other ways of integrating everything that you've learned into the curriculum for medical students that had if that had come up at all. I don't know, maybe Esther would like to address that.
Yeah, so Lisa, I wonder if I understand your question correctly about whether if there's a different format of kind of sharing what we have created. Is that what you're asking?
Yeah, I guess more, for the pediatric residents, the workshop format seems like really valuable and really helpful. Are there ways, do you think that this content could be integrated into like coursework or into other ways that students are learning about the importance of involving families?
Yeah, this is kind of a culmination of the work that Cynthia and I have been doing for the last kind of 10 years in the med school setting, where we have involved family partners in sharing their stories to second and fourth year medical students. But this was our big project, like getting them involved right from the beginning, as opposed to come share your story, which still, like, medical students love that. But this was really targeted towards what should pediatric residents learn, with pediatric residents also kind of giving feedback and being part of that process. Yeah, I mean, I think there's so much work we could be doing, and we recently presented at the Patient Voice Conference, which is all about how to incorporate patient and family voice in medical education. And I think the ongoing challenge is that there are a lot of people like us where we are trying to incorporate patient and family voice, but it's a lot of work, and you do need that support and also money to do this. And I don't know that a lot of universities have the infrastructure and support yet to do this. So I think, the question I have is, we have all this information. If we did it in like a online module format, would it have the same impact? I'm not sure. I hope somebody tests it out. Or is it that key interaction that you have with families, even after you watch the video? Is that the key part? Or can you do that online as well by people kind of writing back and forth? So yeah, I'm curious how that can be. The family engagement and research course, it's actually all of that hybrid in one go. And they've been doing that for a very long time. So they kind of have had different iterations of that too. So yeah, I think to answer your question, I think, yes, there are a lot of ways to do it. The question is, yeah, what is the infrastructure and kind of the support for everyone who's going to be involved in that process?
Thanks so much, Esther. So much potential.
Mm-hmm.
To share further. Jennifer, you had a question that you can share?
Well, we have some great questions in the chat now, but I just was going to ask Judy, can you stop screen sharing so we can see all the panelists? Thanks. And Lisa, I'll let you facilitate.
Sure. So we have one question here from a guest. For the patients and family partners who are involved, can you expand on some of the examples about how you were made to feel safe while doing this work?
Sure. I think that, first of all, we had a really great role of Cynthia, who has had previous experience with both worlds and connecting us together. As well, when we first had the initial meeting about this, there were several other people that attended, and it was left up to who really had the emotional energy, the time for this to happen. Everyone was really concerned with making sure that we were all in a place that we could put this work in. And so it was left up to families. There was also, I remember that there was lots of suggestions about making sure that there were counseling options, that there were different times to make sure that the families could be involved in a safe way. And ultimately, it was a lot of the group meeting together and talking a lot. So I felt really, really clear that everyone kind of knew where we were coming from. And it wasn't, we were all pretty open with our lives and what life is like. And we all were able to share that pretty clearly so that we knew that the team behind us knew where we were coming from and could understand the world that we're a part of.
And I would add that there was a really unique tone that it's okay to disagree. And this was created by everyone in the room with constant reminders that we are dealing with a complex system, we're dealing with complex lives. And every one of the family partners that shared their lived experience, I would say everyone else on the team that wasn't a family partner shared their, I'm not going to say work experience, it's their lived experience with their work. And the gentleness that was promoted by everyone on the team and then made steady through created this, we're all in this together. We all know why we're here. We all know we want to see improvements. So therefore, everyone's story has value, even if you disagree. And on a somewhat personal note, that went right into the live presentation where there was another family partner and myself. Our lives it was opposite. What we prefer is opposite. What we experienced is opposite. But there was almost joy in describing those difficulties because we're trying to share the message that both of these things can be true. And that is okay that this was true because we're here now working together to see what can come of it. And I just can't I can't express how grateful I am that that tone was maintained from the beginning, from everyone and throughout.
Thanks so much for that, Linda and Karen, for your thoughtful answers there. The next question is a little bit linked, but the person is asking, were there any surprising or unexpected things and perhaps challenges that came up when involving parent or family partners in such a robust way, given that the norm is often different and is often, is usually more tokenistic? Were there any related learnings to pass along? I don't think that's directed at anyone in particular, but Cynthia, it looks like you have a response.
I think we were very impressed with how forthcoming and how open our family partners were in sharing their stories and really sharing some very difficult circumstances in order to illustrate why change needed to happen. And, I think, this was a little different because we really did get to know our family partners in a different way, in an in-depth way than just perhaps, as Esther mentioned, where they would come in and present for, 20 minutes to our med students. We followed, we asked, how's your family doing? How's so-and-so doing? Are you okay? What are you doing for Christmas? What's new with this week? And so, there really did develop that camaraderie and that community. And I think, that was a really neat opportunity. And like I said, we were really sad when it came to an end. I think we all felt a little out of sorts. Well, shouldn't we be having a meeting or something, And so I think, I think we all kind of secretly want this to continue so that we can continue and build and see where else we can take this, working as a team together because we are so connected. Esther.
Yeah, and I will add, I think I wish we can say we had everything planned and it just went exactly as planned. But it was, especially at the beginning, I think we were pleasantly surprised. There were so many families who wanted to work with us. And I can't remember the exact number we had hoped for, but we went more. I don't think we thought 7 is a lot of people. And yet it just worked. And as Linda kind of said, to have the different varied experience and to really show the residents like this is all true and real. Everybody's experience matters, right? There's no one way to have a journey through our medical system when you have a child with medical complexity. I think that made the workshop and the learning so much more true. So yeah, that was the surprising, unexpected part for me, was that in the beginning, we didn't expect such a wonderful kind of group of people, and for people to all stick it out, to be honest, because we thought, oh, maybe somebody will, something will happen, and no, everybody just continued. So that was wonderful.
I just wanted to add that, like probably in our first meeting, we established like very early on that one of our key messages is probably going to be that you need to ask families for their own preferences because everybody wants something different. And we really celebrated that fact that we're all really different. Each family has a different experience, and based on those experiences, they have different preferences. And I think because that was so well established from the start, no one was scared to speak up and share their different opinions. I remember we had this whole conversation once of, I don't like it when the doctors just call me mom. I wish they said my name. And someone else said, I kind of like it when they call me mom. I like the mom, you know? So there was a lot of that kind of back and forth, but no one was scared to like disagree with one another because we celebrated those differences.
I wanted to add that you can never make enough time. You can create supportive borders to end meetings with care, but we're always going to be wanting to expand our thoughts. And one of the things for me that was a surprise, I don't know why, it just was that we were presenting on the hospital grounds, which many of us have a mix of experiences with. So entering those grounds can have a certain feeling. And we were able to voice that, have a safer space, but also have the team encompass us emotionally and physically so that we could know that we're entering for this purpose and try to help shield any of those other feelings that might come up. But when I say you can never plan enough time, even just going to the debriefing room where we know there's going to be snacks and we're going to relax, we know those grounds. As a group, I think the families looked like birds on a beach, just one person going, then we gather as a group, and we kind of moved slowly to that room and all had our moments as we enter the sliding doors of the building, of the impact that that building has had on us. So even when it's all done and it's time to celebrate, we're still taking unexpected time and unexpected emotions and needing that care from the entire team to get us get us to the snacks. So in a sense, you can plan for it, but you can't plan for it. So being mindful of it is what you can do.
The person asking the question had asked, like, is there any related learnings to pass along? I just wanted to say that I think for meaningful family engagement to happen, you need to have time. If you have like a strict agenda or a strict timeline and you're saying, okay, that like these are really great conversations, but we need to move on, it just doesn't happen as naturally. And we had lots of time to just chat and get to know each other, and that made everything so much better in the end.
Thanks so much, Judy and Linda and the others who responded to that question. Very, very valuable. I think we have time for one more question, Jennifer. We have one here. Thank you for all your work. I'd be curious to know how this might be modified for other health professional students like OTs, PTs, speech language. I would put nursing in there too. So if anyone has any ideas of how to this could be expanded in that way.
From the parent family side, yes, all of anything that affects our children, yes, to anything. I think that outside of, a lot of our kids have lives outside of the hospital, and a lot of people don't understand what medical complexity is and the stress of our lives and why we're late to every single appointment that's ever happened, and why we need extra time for paperwork, why we cannot handle another piece of paperwork. All of these are important for our kids' lives, and maybe why they, in my son's case, shows up very, very grumpy to certain things. And without the understanding of the background that our kids are facing, when it is something, like you said, like an OT or nursing or any of these things, they all affect our kids. And more knowledge and awareness is never a bad thing. I think to add that it's really important to have lived experience. So as long as this is adapted to families that are actively participating in those groups, I think that this is something that could and should continue through all areas that meet with any child, any pediatric who's complex.
Thanks, Karen. And I would agree, this provides a wonderful model that can be taken up by other health professional schools. So thanks for that. There's one comment about sharing the slide recordings, and we will be sharing those. I think, Jennifer, you'll give a little plug at the end for the Thrive Kids website, and I'll turn it over to you, Jennifer. So thank you to all the presenters and to the attendees as well for your thoughtful questions. And so, Jennifer.
Thank you. Thank you so much, everyone. I think that I would just say so often our research is about the experiences and the perspectives of families, and this work takes it through to, having an impact, that knowledge translation, knowledge mobilization that education has. So it's really transforming what's happening for families in the care environment, which is really exciting and really key. I'd just like to thank everybody who has joined us today. This kind of brings a conclusion to our year of webinars as we see the wrap up of 2025, and I don't think it could have been any better or more meaningful. For those of you who are regular attendees, this is sort of the end of the first round of our Thriving Kids Research Cluster. We'll be applying for renewed funding for the next round, so we're fingers crossed that will happen. And I just wanted to let you know that we will have a webinar series starting up again early in 2026. If you are signed up for our newsletter, you'll get that information. To answer Cam's question in the chat, all of the webinars are recorded and posted online. And if you've RSVP'd for this session, which you will have done because you're here, you will receive that link in the next few days. And other than that, I wish everybody all the best for the end of 2025 and the beginning of 2026. And we'll look forward to continuing our conversations online in the new year. So bye for now.